Hello, everyone. My name is Ling Zhang from Alibaba DAMO Academy, Medical AI Lab. Today, I would like to present the recent advance in our lab's research on the using AI for the detection of multiple diseases, including cancers, acute diseases, and chronic diseases. This technology will pave the way for a more accessible path to global health. First, I will provide a brief review of the cancer screening background, and then I will introduce our recent groundbreaking research on the screening of pancreatic cancer and gastric cancer, as well as our study on the rapid diagnosis of acute aortic syndrome. Finally, I will share the vision and future outlook of our lab. First, let's take a brief look at the background of cancer screening. Cancer and heart disease are the two leading diseases affecting humanity. Today, the heart disease mortality is decreasing year by year, while the cancer mortality remains high. Screening is the most effective way to reduce cancer mortality. For example, a recent study published in the Journal of Clinical Oncology has shown that screening can improve the deadliest pancreatic cancer survival by 8 years. However, only 4 types of cancer have guideline-recommended screening protocols. As much as 70% of cancer deaths occur in cancer types without guideline-recommended protocols, such as gastric cancer, liver cancer, esophageal cancer, and pancreatic cancer. We have made a breakthrough in the field of pancreatic cancer screening. The relevant study was published in Nature Medicine in 2023. We propose a novel model called PANDA, which is based on non-contrast CT and deep learning, and hold promise for large-scale, non-invasive, and accurate screening of pancreatic cancer. As a king of cancer, pancreatic cancer has a surgical resection rate under 20%, and a 5-year survival rate less than 10%, which is the lowest among all malignant tumors. However, there has been no screening method for pancreatic cancer for individuals at average risk. The key reason is that the prevalence of pancreatic cancer is very low. It's only 11 cancer in every 100,000 people. And a practical screening method needs to have extremely high specificity, which is very challenging. In our paper, we validate our PANDA model on multi-center data set of 30,000 patients. And we also validate our model in a real-world consecutive patient cohort of about 20,000 individuals, which include data from 4 scenarios: the physical examination center, emergency department, inpatient, and outpatient. Our model PANDA achieved a very high sensitivity of 92.9% and an extremely high specificity of 99.9%, which means that among 100 tests of healthy individuals, only 1 would be a false positive. Our work pioneers an AI-driven era of medical imaging screening. And our work obtained a lot of international recognition, such as Nature Medicine's commentary article and the Fortune 2022 changed the world list, the top 10 company, and the Stanford 2024 AI Index report. And recently, Alibaba DAMO Panda received FDA breakthrough device designation. After the publication of our paper, we deployed Panda in several hospitals in China and conduct prospective clinical trials. In hospitals in Shanghai, Ningbo, and Zhejiang, we screened over 70,000 patients and identified 16 cases of clinically missed pancreatic cancer, 10 of whom have undergone surgery. Among these, there was an extremely early stage pancreatic cancer measuring only 1 millimeter and one carcinoma in situ. This is a case of the 1 millimeter cancer. It's 1 millimeter, not 1 centimeter. So a 75-year-old patient underwent a routine physical examination at the hospital and had a low-dose chest CT scan. Her tumor markers were only slightly elevated for CA125, while other markers were normal. Our model Panda alert and indicating a 76% probability of non-PDAC. And the patient was recorded for a contrast-enhanced CT, showing that there is a tumor in the pancreatic head. And after surgical resection, the pathology report showed that the tumor is a very early stage pancreatic tumor with a truly malignant portion measuring only 1 millimeter. This slide shows patient CT images and the Panda segmentation and classification results. On the right is a patient post-operative pathology report indicating small tumor, the true malignant portion measuring only 1 millimeter. This is another case of the carcinoma in situ. She is 33 years old, and she visited the emergency department due to pneumonia and underwent a non-contrast CT scan, non-contrast chest CT. And our Panda model alert a non-PDAC as well, with a probability of 100%. The patient was recorded for an contrast-enhanced CT, which showed that there is a 38 millimeter tumor in the pancreatic head, and suggesting a malignant transformation of IPMN. At the very beginning, the patient refused surgery because her parents are hearing disabled and non-speaking. So she had to take care of her parents every day. Fortunately, 3 months later, she underwent surgery, and the pathology confirmed a carcinoma in situ. This is her CT image and our Panda segmentation and classification results. And surgery of the carcinoma in situ implies a cure with an expected survival of over 50 years. After our breakthrough in pancreatic cancer, we have also made a significant advancement in gastric cancer screening. This may be equally important because the pancreas is a solid organ, while the stomach is a hollow organ. And whether AI can successfully detect the gastric cancer in non-contrast CT imaging remains an unknown. The medical community has long believed that CT imaging is not suitable for detecting gastric cancer. Only endoscopy is an acceptable method. And our finding was just published in Nature Medicine and hold promise for large-scale gastric cancer screening. We established a large-scale data set, including 100,000 patients from 20 centers, including 10,000 patients with gastric cancer. Our model is called GRIP, which stands for Gastric Risk Assessment Procedure with AI. GRIP can simultaneously segment the gastric cancer and provide the probability of gastric cancer. The sensitivity of GRIP in detecting gastric cancer is above 80%, and the specificity is 97%. And we conducted retrospective validation of GRIP in a large-scale real-world data set. This slide shows the results of one hospital, which includes about 20,000 patients. And the GRIP identified 6% of them as high risk. And among these, 24% of these are real gastric cancer. In addition, GRIP can also detect cancer before clinical diagnosis. Here is an example. When at the time of diagnosis, at the time of the gastric cancer diagnosis, our GRIP can give a probability of 0.99. And 6 months ago, for the same patient's CT scan, our GRIP model gave a probability of 0.67, indicating a high risk. The red mask are the gastric cancer's region segmented by our model. In addition to cancer, we have also made breakthrough in detecting atypical acute aortic syndrome, AAS for short, using non-contrast CT for rapid and accurate detection. While non-contrast enhanced CT is a gold standard for diagnosing AAS, it is usually used for cases with a high degree of suspicion. Our AI model, IALTA, utilizes non-contrast CT images to detect AAS and issue alert immediately, seamlessly integrating into existing emergency workflows. In a prospective clinical trial, 15,000 patients present with chest pain and receive non-contrast CT scan. With our model, IALTA's help, radiologists identified 21 atypical AAS cases, resulting in a sensitivity of 95% and a negative predictive value of 99.9%. Our approach effectively identified high-risk AAS patients for timely referral to contrast-enhanced CT. Here is an example. One patient came in with abdominal pain and received a non-contrast CT scan. IALTA alerted the radiologist, which led to further tests and a diagnosis of a Stanford type B aortic dissection within only 94 minutes of admission. This shows how IALTA can help reduce missed diagnosis. Here is our lab's vision and future outlook. Starting from pancreatic cancer, we have expanded AI detection capability to include 6 types of cancer, 3 acute conditions, and 4 chronic diseases. Our solution enables non-invasive, accessible, and highly accurate detection of various diseases through a single non-contrast chest or abdominal CT scan. We are collaborating with institutions globally, including Singapore, Japan, Saudi Arabia, New Zealand, and the United States, and Antigua and Barbuda. Our mission is to bring the benefit of our medical AI to more places and patients in need, achieving the vision of AI for health in real-world application. And we hope that these innovative medical AI technologies can benefit all of humanities. Thank you so much.